Good morning, guys. As it happens, girls too. Because yes, we have been seeing female HRT patients for the past 2 years. Why? Well, the premise behind the clinic was to address testosterone deficiency. And we did that. And our patients demanded a female version of microdosing TRT. So what did we do? We came up with female microdosing of HRT. Now, as you guys know, TRT at the Men's Health Clinic is not TRT, it is HRT. Gold standard TRT is daily test SIP and HCG. So female HRT. Well, the NHS provides you with a cookie cutter approach and does not cater to biological individuality. Now, your dose would not be the same as the next female's dose because you are unique. Your DNA, your genetics, your physiology, your requirements are all particular to you. So it makes no sense having a one-size-fits-all methodology for female HRT. But much like male TRT, you have to understand pharmacokinetics. You have to understand the premise behind having a healthy hormone level for optimal well-being, because hormones are integral for your overall physical and psychological well-being. So what do we do here at the Men's Health Clinic? I apologize, the name, but it is what it is. Well, we utilize estradiol valerate injections alongside testosterone cypionate injections and balance it against progesterone. So again, you need to think of hormones having a bit of a seesaw effect. On one side of the seesaw, you've got estradiol and testosterone, and on the other side, you've got progesterone. Now, the female menstrual cycle is fascinating. Why do you have these fluctuations? Do they confer a health benefit? Well, the answer to that question is no, not really. They're there simply for ovulation, so you can pass on your DNA to the next generation. There's no biological advantage in having fluctuating hormone levels. Is that true? Yes and no. Well, let's break it down. The first part of the cycle is the follicular part. Now, what happens then? Well, you're producing the egg, and your estradiol and your testosterone are rising. How do you feel? Well, your mood's typically good, your libido's good. Then what happens? The egg gets released, and you have a spike of estradiol, and then a subsequent drop. And then what happens? Well, interestingly, your progesterone starts to go up, doesn't it? And how do you feel then? Typically, calmer, better sleep, but a slightly lower libido. Now, why is that? Because you don't need to have sex, because hopefully you've conceived and you're getting your uterus ready for implantation of the egg and subsequent pregnancy. What happens at the end? Yes, the end of the luteal phase, you get a drop of progesterone, and that drop of progesterone can cause troublesome symptoms. And then what happens? The cycle repeats. But as I've just said, there's no real biological advantage from a cardiovascular health, a bone strength health perspective for these fluctuations. Now, let's break it down even further. Now, we know that male hormones follow a diurnal pattern. Day-night, day-night, day-night. Your anabolic processes predominate at nighttime, and your catabolic processes predominate in the daytime. Female hormones are slightly different. So, they are there really to aid the menstrual cycle. So what happens when you no longer produce eggs, when your estradiol drops? Well, guess what happens? Your estradiol obviously drops, your testosterone obviously drops, and your progesterone drops. And how do you feel? Well, it can cause troublesome side effects and symptoms. So we all know hot flushes, loss of libido, etc., etc. But let's go back to the premise behind having healthy hormone levels. Optimal physiology, how your body functions. And we know the role of estradiol is vast. It's neuroprotective. It's going to give you empathy, insight, and understanding, which is why women have more empathy, insight, and understanding than us men. Now let's talk about estradiol and testosterone, because that is fascinating. So, do you realize that women have more testosterone than estradiol? And when we compare testosterone levels between males and females, if we think about an average range of perhaps a man having 20 to 30 nanomoles and a female having 2 to 4 nanomoles, you can see the disparity is vast. And that's the primary reason why we do have an advantage when it comes to sports, because testosterone is a performance enhancing drug. And then you think about estradiol, the predominant sex hormone in females. Well, it obviously just said it's not, is it? But women have more estradiol than men. So wow, can you not see the ratios of these hormones are very vast and different? Whilst we share the same hormones, the numbers, the quantitative numbers are different. And how those hormones impact your physiology is dependent on your sex and your genetics, your DNA. So when we talk about estradiol, we've just said it's neuroprotective. What else does it do? It's cardioprotective to a degree. Because guess what? Anything in excess, yes, anything in excess is bad for you. How disappointing. But that's true, obviously, because the body survives on the concept of balance. You need contrasting purposes in order to achieve harmony. And that's what we're all aspiring to achieve. Balance. Bone mineral density. One of the cardinal signs of post-menopause is what? Yes, osteoporosis. So estradiol is necessary for bone mineral density, as is testosterone. The list goes on. Now, women are realizing that they do need testosterone in HRT, not just estradiol. And again, why is that? Well, you might know because of mood and libido and cognitive function, but again, it follows the same role as testosterone in men. Red blood cell production, bone mineral density, helps lipid regulation. Again, the list goes on. So fundamentally, you are your hormones. Your nervous system and your brain will impact how you feel. But fundamentally, you are your hormones. Now, we've spoken about this seesaw. So we said, on one side, you've got testosterone and estradiol. And on the other side, you've got progesterone. So what does this one do? Why do you need this in HRT? Because, in theory, you don't need it if you haven't got a womb, because it's there to protect the lining of the womb. But actually, your mood should be calmer with progesterone in it. Why? Well, the steroidogenesis pathway involves progesterone, and ultimately that cascades down to GABA, the calming neurotransmitter, which is predominantly why you have... Dexter's just distracted me, haven't you? That's probably predominantly why in the luteal phase you feel calmer and you sleep better. How fascinating is it? hormones. So what do we do here at the Men's Health Clinic? Well, yes, we microdose HRT, testosterone cypionate and estradiol valerate, and we balance it against progesterone. And we carefully titrate your dose according to effect to where you feel best and to where there are no negatives as a result of having excess or deficient or abnormal ratios. Now, there is no one-size-fits-all methodology. So you are biologically unique. So your dose needs to be carefully titrated according to effect. And the best way of achieving stable levels is injections. Much like men, it is injections. But because you don't follow that diurnal pattern, day, night, you don't need daily injections. And typically, your SHBG is higher, obviously, because of estradiol. You can get away with, no. Optimal injection frequencies for females is every 3.5 days when you understand the pharmacokinetic profile of estradiol valerate and testosterone cypionate. Quite simple, really. I don't know why the NHS has this cookie cutter approach and subsequent private clinics have a cookie cutter approach, because if you understand physiology, if you understand pharmacology, and if you understand the premise behind a therapy should be normalization of hormone levels, estradiol valerate and testosterone cypionate injections balanced against progesterone makes perfect sense. So that's it in a nutshell. Female HRT at the Men's Health Clinic. For more information, there are a couple of articles on the website in the education section. And if your partner's interested, or you are a female interested, obviously do not hesitate to contact the Men's Health Clinic. Sorry, we're not going to rebrand. So yeah, apologies. The name, it is what it is. So I will end this as I always end my videos. Go earn your reward.